know that. Today we'll be talking about diabetes mellitus and why it could actually be life-threatening. Welcome to Your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Olaide Jinodu. If you're not yet subscribed to this channel, I know you're missing out. Why don't you subscribe right now and hit that notification bell so you get notifications every time I post new videos. Now straight to the chase. What is diabetes mellitus? Diabetes mellitus is a disease of the body's metabolism of sugar. What does all that mean? It's a disease affecting the body's control of blood sugar. Normally when you eat, the food is digested to its building blocks. For carbohydrates, it's glucose. For protein, it's amino acids. For fats and oil, it's fatty acids. Diabetes mellitus is majorly a disease that affects the body's control of glucose. You can call that sugar. There are a few types, but I'll mention just the common ones. The common ones are type 1 diabetes, type 2 diabetes, and gestational diabetes. We'll talk about gestational diabetes in our next video. We'll just focus on type 1 and type 2 diabetes. Type 1 diabetes is also known as insulin-dependent diabetes, meaning type 1 diabetes is caused by the absolute deficiency of insulin in the body. Now, insulin is the hormone produced in the body. What's an hormone? An hormone is a chemical substance that is released by one organ and causes an effect in yet another organ or another system entirely. Now, insulin is one of these hormones. Its function is to regulate the body's glucose. It is released by the islet of Langerhans in the pancreas. I know that's a mouthful, but just stick with me. Normally, insulin is released as a reaction to the body's elevated blood glucose. That's after a meal. Your body's insulin is expected to rise to take action, send insulin to its appropriate quarters. However, type 1 diabetes has a problem of absolute deficiency. So insulin is not released in type 1 diabetes. Now, this person's blood glucose keeps going haywire. There is no form of control, and that's what type 1 diabetes is. Type 2 diabetes is a relative deficiency of insulin. Now, this could be either a little amount of insulin is being produced, or there's a normal amount of insulin, but the body is just not sensitive to insulin. There are things that can cause that too. We'll get there. Let's talk about the risk factors of type 1 diabetes. The very first one is it has a very strong hereditary or familial predilection, meaning it is being transmitted from generation to generation. You can get it from your parents or second degree relatives. It could depend on the environment you find yourself, the kind of lifestyle you're exposed to, and it also can be as a result of some autoimmune diseases. Now, what's an autoimmune disease? An autoimmune disease is when the body's immune system gets confused and starts to fight against its body cells, your body cells, instead of defending it. That's what an autoimmune disease is. Now, if an autoimmune disease affects the pancreas, remember I mentioned that insulin is produced from the islet of Langerhans in the pancreas. If the pancreas is affected by an autoimmune disease or any disease whatsoever, it can predispose to type 1 diabetes. Now, what are the risk factors of type 2 diabetes? It also has a strong familial predilection, meaning it can be transmitted through generations, from parents to children. Your weight can be a risk factor. Obesity is a key factor in diabetes. Why? Because it's been found out that the more weight you have, the less sensitive your body is to insulin, or the more resistant your body becomes to insulin. Another factor is a sedentary lifestyle. When you're very inactive, you like to drive, you're chauffeur-driven all around, you never take exercises, you always send people on errands, you're always using your mobile phones, you order everything, you basically don't do anything. You're always inactive. Your age is another risk factor to type 2 diabetes. The older we get, the higher the possibility of type 2 diabetes. Gestational diabetes could also be a risk factor to type 2 diabetes. Now, what is gestational diabetes? Remember, we said we'll talk about this next week. Gestational diabetes is that found in a woman who is pregnant. Normally, when she is not pregnant, she has no problems with diabetes, but the pregnancy seems to induce diabetes. Any woman with gestational diabetes stands a chance or a risk of developing type 2 diabetes in the future. Funny enough, hypertension has also been found as a risk factor to type 2 diabetes. Other conditions that can predispose you to type 2 diabetes are polycystic ovarian syndrome. This is a very common cause of infertility in women. Another condition that can predispose you to type 2 diabetes is abnormally elevated cholesterol and triglycerides in your blood. Now, what are the signs and symptoms of diabetes in general? There are three major signs and symptoms. We have polydipsia. Polydipsia means drinking a lot of water, extreme thirst. Polyphagia. Polyphagia means eating a lot due to extreme hunger. Polyuria, meaning passing out a large amount of urine. Other signs and symptoms are unexplained weight loss, that's in type 1 diabetes, and the converse in type 2 diabetes. Fatigue, unexplained weakness, just generalized body weakness. Irritability, blood vision. Now, doesn't mean that every blood vision is caused by diabetes. These are just signs and symptoms that you might possibly be diabetic. You notice that your wounds are not healing as they should. Slow healing wounds. You're thinking of diabetes. Frequent infections of the gum, the skin, and the vagina in women. What are the possible complications of diabetes? If diabetes mellitus is not quickly diagnosed or poorly treated after being diagnosed, you stand a chance of some complications. Number one, a cardiovascular disease. Cardiovascular. Cardio, the heart. Vascular, blood vessels. The arteries, the veins, but majorly the arteries here. It could predispose you to atherosclerosis, where you find fatty plaques within the blood vessels. Coronary heart disease. Coronary arteries are the blood supply, the arteries that actually supply the heart. Diabetes can actually complicate this and cause a problem with the blood supply to the heart, causing a coronary artery disease. Number two, you can have neuropathy. Neuropathy has to do with problems with the nerves, problems with the perception of pain. You notice you step on the pain and you don't even feel the pain, especially with the feet. You don't feel like you used to. You don't perceive stimuli, pain, touch, heat, change in temperature, as it were. You don't perceive these things as it used to be. You are thinking of neuropathy. Neuropathy is a complication of diabetes and must be treated immediately. Number three, nephropathy, from the word nephron. Nephrons, we find nephrons in the kidneys. These are the cells we find in the kidneys responsible for the day-to-day functioning of your kidneys. So nephropathy, the word pathy talks about pathology, a disease state. So a disease state of the kidneys. Nephropathy can be a complication of poorly or undiagnosed diabetes. Number four complication to diabetes mellitus is retinopathy. Retina from the eye, pathy like we spoke earlier, pathology, meaning a disease of the eye or sight, can be a complication of diabetes mellitus. Remember, we made mention of blurry vision as one of the signs and symptoms of diabetes. Yes, if not treated early, it can be a complication which can even lead to blindness. Number five complication to diabetes mellitus can be damage to the foot. Now, this can occur from neuropathy. Remember, we said that when you fail to perceive pain or nerve sensation generally, it can lead to damage to the foot. You step on a needle or you step on an hot surface, you don't feel the pain, a wound will arise with very poor wound healing. If the blood sugar is not regulated well enough, this foot stands the risk of being damaged and thereby amputated due to poor or no blood supply to this foot. Complication number six, skin condition, various skin conditions. Diabetes mellitus, if not treated properly or early enough, can lead to various kinds of skin conditions, recurrent skin infections, bacterial and or fungal. Complication number seven, hearing impairment, meaning it can affect the ears too. Complication number eight, Alzheimer's disease from dementia. This can affect the brain. This is also a very common complication to diabetes mellitus. And the final complication I have on my list here is depression. Type 1 and type 2 diabetes are a common cause of depression. How can diabetes be treated? Depending on the kind of diabetes we're talking about. Type 1 diabetes, type 2 diabetes. Type 1 diabetes, do not forget, type 1 diabetes is absolute insulin deficiency. So the only treatment so far for type 1 diabetes is insulin injections. The body is unable to produce insulin, so we have to get insulin from an outside source. So the person has to get insulin every day. The day you choose to stop taking insulin, complications can arise. Now for type 2 diabetes, there is relative insulin deficiency, so oral hypoglycemics, meaning anti-diabetic drugs, should just suffice. There are various types. You meet your doctor, you see your doctor to prescribe the appropriate ones for your needs. How do we prevent diabetes? Simply avoid most of the risk factors. You can avoid a family predilection, but you can control your environment. You can control your diet. You can modify your lifestyle. Ensure that you have regular exercise. You drink a lot of water. You regulate your sugar consumption. Now, when I say sugar consumption, I'm sure you're thinking of just sweet things. Sorry to burst the bubble. You don't necessarily have to eat something sweet to increase your blood sugar. If you eat a diet which is predominantly carbohydrates, you stand a risk of elevated blood sugar. So in essence, get yourself screened for diabetes. There are various investigations to do. There is a glycosylated hemoglobin, also known as HbA1c, which tells you how your blood sugar control has been for the past 2 to 3 months. Go do these tests regularly to ensure you're on the safe side. It's better to be safe than sorry. And always remember, health is wealth. If you just loved this video, I would have you like, post a comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye for now.